Hey guys, Human from Door One Health, and in this video I'm going to show you how to perform a biceps curl exercise properly. I'm going to discuss how to do this exercise with the right form, and the way I'm going to explain that is based on a simple anatomy of the muscle and the function of the muscle. So I guess this is a better way for you guys to memorize the form, because I can just tell you, okay, so this is how you're going to do the exercise, but if you just know a little bit of the anatomy and the function of the muscle, this is going to help you to understand, and you know the reason why you have to, for example, bring the elbow forward or backwards. So it's a better way of memorizing or understanding why this is the right form of doing that exercise. So biceps, you know, most of you guys know that this is the muscle on the anterior side or on the front side of your arm, but that's not the only muscle here. So this mass, the volume that you have on the front side of your arm, is a combination of that biceps brachii, that's the medical term for that muscle, so biceps brachii, and also underneath that muscle you have another one, is called brachialis. So what you see on the front here is both of them, but brachialis is kind of hidden underneath biceps. You may be able to see a little bit of it from the sides, this side and that side, but what you see in front is just a combination of both of them. In terms of function, so the muscles that they're located on the front side of your arm, they're mainly in charge of flexion of the elbow. So you bending your arm like this and flexing your elbow. But biceps brachii has other functions too. So based on these functions, we're going to discuss how to do the exercise properly for that. That biceps brachii, bi means two. So biceps means the muscle has two heads. So the muscle is located here. It has a long head and it has a short head. So the long head of the muscle, so it's basically it's attached to the humerus, this bone, but on the top part. So that's a long head, and the short head, it attaches to this part of the scapula bone. It's called coracoid process of the scapula, but that doesn't. It's not actually important. But you know that these two heads are the heads of the biceps, and they're coming down and they attach to this bone of the forearm, which is called the radius. So imagine the muscle is kind of coming from here and here and going down and attached to this radius bone, which is on the outer part when you're standing like this, on the outer part of your arm. So because this muscle, one of the heads attaches to the shoulder joint, it can actually function on the shoulder joint. The other ones, no, the other one is only responsible for bending the elbow. But this one that attaches to the shoulder joint can actually flex the shoulder. So biceps brachii can flex the shoulder, so you can bring the arm like this forward. So this is a flexion of the shoulder. So for now, you know that the biceps can, because it attaches to this bone of the forearm, it can flex the elbow, and also it can flex the shoulder. Okay, we got to remember this, because when we explain the right form of biceps, we need to remember this. So the other one, again, I don't want to go through a lot of detailed anatomy, but the other function of the muscle, again, because it attaches to this bone here, is turning your forearm this way, which is called supination of the forearm. So biceps brachii basically has three functions. One is flexion of the elbow, one is flexion of the shoulder, and one is supination, or turning the forearm this way. So basically your thumb is turning outward like this. So what does that tell you? If I want to work out this muscle, I cannot just focus on one function. So if I just bend the elbow here, yes, of course you're working on the biceps, but it's not the whole thing. So if you want to focus on the whole thing and get all the functions of the biceps, so if I want to do biceps curl, I need to do all three functions. So all three functions included in that movement. So one is supination of the forearm. So I have to make sure that I'm turning my thumb outward like this. And then flexion of the elbow. And then a little bit of shoulder flexion, which is going to bring my elbow a little bit forward. So instead of going like this, I'm gonna do this, and then elbow comes a little bit forward, just to get that shoulder flexion function out of biceps too. So now, if I wanna go back to the starting position, so I'm gonna bring the elbow backwards, and then I'm going to extend my elbow. So again, from here, which is like a neutral position of my forearm, I'm gonna turn, I'm gonna supinate my forearm, then I'm gonna flex the elbow, and then I'm gonna flex the shoulder a little bit. Now I do the opposite way. So elbow goes back, and then I extend the elbow, and then forearm goes back to neutral position. So these are the things you should know. So it depends on different, you might have like different exercises for biceps, but when you know all the functions that biceps can do, then you can think about how to do all these three functions. For training or working out the muscle, which I mentioned before, which is underneath the biceps brachii, which we called it brachialis. So that muscle doesn't attach to the shoulder, and also it doesn't supinate or pronate the forearm. So it doesn't do this or that, right? All it does is just flexion of the elbow, which means if I want to work out on brachialis, then I don't need to turn my forearm this way or this way. I keep it neutral, and then I'm going to do this curl. I just bend my elbow, right? So this way, just by doing this hammer curl, they call it hammer curl, which means the forearm is in neutral position and the elbow doesn't move forward. It stays here, right underneath my shoulder, and then I'm doing hammer curl. So this way, of course your biceps brachii works, but the main focus will be on brachialis, because the brachialis is the main flexor of the elbow. So it's not biceps brachii. The brachialis, which is the underneath muscle, is the main muscle that performs that elbow flexion, so this movement. The other muscle that is involved in this area is brachioradialis. So brachioradialis starts somewhere on your humerus, on this bone here, and it comes and attaches to the outside of your wrist, like this bone, end of that bone. So somewhere around here. So it comes from here and it goes to here. And basically, again, when you're doing this hammer curl, you're working on that muscle too. But that muscle is just, the mass of that muscle is mainly located here, right? So it's not on this region. So again, brachioradialis can be worked out by doing that hammer curl. So these are the things I wanted to discuss, because if you know a little bit of anatomy and the function of the muscle, so you have a better understanding of how to perform the exercise for that particular muscle. So I'm trying like to just make more videos that this is the approach that we have about explaining how to perform the exercise, just by giving you a little bit of information about the anatomy, just a simple anatomy and the function of the muscle. One thing I have to point out here is you probably, this is actually very common between the female clients or women, that when they're doing biceps curl, you probably, here I'm going to exaggerate just to show you the problem. They have a position like this. If you see, like the elbow, the inner side of the elbow is here, and my forearm has like a bigger angle. So when they're doing biceps, they're doing like this. So why this problem happens here? I'm going to explain that, because a part of that is normal. I mean, like here, there is an angle between the bones of the forearm and here, which we call it like the cubital region, that region, the elbow region. If this angle, so women they have a bigger angle, right? So normal angle of these bones with your elbow is probably somewhere around here. So if the arm is like this, again I'm exaggerating to show you, which is called the cubitus varis here, or it's like this. So you see this angle again here, that's a lot, this angle, the cubitus valgus. These are all not good. So when you're doing the exercise, this is wrong. Basically, you're putting pressure on some structures that you're not supposed to. But if you have a normal angle, so obviously like you're doing it right. What you can do to correct this, a part of that is genetic. If it's like a very big angle here, so probably to some extent you can correct it, but there are other exercises that you can do to correct this condition. But again, if you see someone or yourself, like if you doing biceps like this, then I don't want you like to try to force yourself to turn this, because that might damage your shoulder. That's something that we have to discuss in another video. Again, today I just wanted to give you just like a brief explanation about the function and anatomy of the biceps brachii muscle, and show you the right form of performing different exercises for biceps. Thanks for watching this video, and hopefully I'll see you in next videos.